Hi students, today the estimation is protein, estimation of protein. This is also very important practical exam question, right? So first one is glucose, second one is urea, third one is creatinine, fourth one is protein. All these four are actually kept in your practical examination. You should know about all the four practical examinations. So estimation of serum proteins, okay, that is plasma proteins. So name the plasma proteins, you all know very well. Total protein, albumin, globulin, fibrinogen, okay. That is total protein, albumin, globulin, fibrinogen. Where it is synthesized, we all know it is synthesized from liver. Then immunoglobulins only synthesized from plasma cells, okay. Next is, what are all the functions of plasma proteins? In the last, we will discuss a slide, we will discuss about the functions of plasma protein as well as albumins. Then what are all the methods available for the serum proteins? Only one method, that is Biuret method, which is manually available, and auto analyzer using technique also Biuret method. Other methods are Lowry's method, Lowry, Lowry's method. Lowry's method, Geldal method, and separation of plasma proteins. You know the techniques, electrophoresis and ultracentrifugation, and sometimes chromatography also. And nowadays they are using turbidimetry and nephelometry. These two words are very important newer technique for the estimation of serum proteins. Turbidimetry, nephelometry. Next, you know the structure or formula of the, that is NH2CO, NHCO, NH, that is Biuret. Structural formula of Biuret or molecular formula of Biuret is NH2CONH, CONH2. Then coming to the principle for this Biuret method, right? Very simple. Protein contains polypeptides. These peptides are joined as peptide bonds. These peptide bonds react with the copper sulfate in the Biuret reagent, produces purple or white color complex with the alkaline medium. Actually, estimation of urea, acidic medium. Serum protein estimation, we are using alkaline medium. Some examiners, they will be asking about the composition of Biuret reagent. That is why I am giving separately copper sulfate, sodium hydroxide, potassium iodide, and sodium potassium tartarate. That is composition of Biuret reagent. With this Biuret reagent, the peptide bonds combined with copper sulfate produces purple or white color complex with the presence of alkaline medium. This is the principle of Biuret method. Next one is, what are all the reagents used for this estimation? As usual, serum, that is patient sample, Biuret reagent, standard protein should be given by your lab personnel with the concentration, known concentration. So as usual, the procedure is, you have to take 3 test tubes labeled as blank, standard, and test. Blank means no analyte, addition of all the other reagents, that is distilled water with other reagents but no analyte. Standard means known concentration which will be prepared by your laboratory personnel and you know the concentration, that is known concentration. Whereas test means patient sample, you are going to identify the concentration or estimation of the sample in estimation in blood. So test is unknown concentration. Okay, that is they will give usually most of the labs giving the concentration is 6 to 8 gram per deciliter serum protein. Okay, as usual, incubation period, heating time, water bath, OD, like that. Here the incubation time is 15 minutes, temperature is 37 degrees centigrade, OD, optical density at 540 nanometer by colorimetry. So after this, you will be having 3 readings in your hand. You go apply in the formula. After preparation of the tabular column, next formula, you have to apply the values in the formula. Finally, you will get the result. Usually formula means test minus blank divided by standard minus blank. You all know very well, because all the 4 estimation, the formula is same only. Test minus blank divided by standard minus blank and multiplied by concentration of the standard, right? So finally you will get the result. Here the plasma protein or serum protein or total protein, the unit is very important. Most of the time the students are mentioned about milligram per deciliter. No, it is gram per deciliter. For serum protein estimation, the unit is grams per deciliter. So that's all about the introduction and procedure. Next we will move on to the clinical interpretation. Okay. Yes. Now the plasma protein level we got the in the result you mentioned about your result of serum proteins. Before going to the clinical interpretation, you have to mention about the normal values of total protein, albumin, globulin and fibrinogen. Here total protein is actually 6 to 8 grams per deciliter. Very important, 6 to 8 grams per deciliter. Albumin is 3.5 to 5.5 grams per deciliter. Albumin, okay. Globulin is 2.5 to 3.5. 2.5 to 3.5 grams per deciliter. Fibrinogen is something different, very small. So 200 to 400 milligram per deciliter. This is very important. Fibrinogen is coming in milligrams only. Next one is albumin globulin ratio. Usually albumin is high, globulin is little lesser. So 1 is 1.5 is to 1. Some book says 2 is to 1. Some book says 1.5 albumin and 1 for globulin. So AG ratio is 1.5 is to 1. Right. Next one is how will you interpret the serum protein estimation? Usually after your result, whether the result is coming in normal limit or low limit or high level, right? Here, what are all the low level of protein causes? So many causes are there because albumin or total proteins are synthesized in liver and excreted by kidneys. Usually these two organs will get affected by any diseases involved in liver and kidney. So low level of protein means the first one is malnutrition and malabsorption, lack of synthesis, availability. Second one is cirrhosis. Because of the liver problem, the proteins are not able to synthesize, so low proteins. Carcinoma, stomach secretion, GIT problem. Nephrotic syndrome and protein losing enteropathy, kidney related problem. The kidneys are not able to retain the albumin or proteins in the blood. They will get excreted by kidneys through urine. Severe burns and severe hemorrhage, like shock conditions also, all the proteins will get excreted. So these are all the conditions for low level of protein. Okay. Now, what are all the conditions for high level of protein? Simple conditions, vomiting and diarrhea. They will go for dehydration. That leads to hemo concentration, produces retention of proteins. Very important, protein, high level. Second one is vigorous exercise also sometimes stimulate the protein level. And tuberculosis, very important, infectious disease and multiple myeloma, bone disorder, that is plasmacytoma. This also having high level of proteins. Next one is this AG ratio, that is 1.5 is to 1 is normal. Sometimes they will get reversed, that is called reversal of AG ratio. In which conditions and why? Liver disease, that is cirrhosis of liver, because of the disease of the liver, the hepatocytes are not able to synthesize protein. So albumin level is less, whereas compensatory mechanism, globulin will be secreted in high amount. So AG reversal in cirrhosis of liver. Then multiple myeloma. Here also globulin's level will be high. For the compensatory mechanism, albumin is low, so multiple myeloma, that is excess globulin production. Nephrotic syndrome, the kidneys are not able to reabsorb the albumin, not able to retain the albumin. They will get excreted by the kidneys in nephrotic syndrome. So albumin less, globulin high, AG ratio. Chronic infections also, albumin will get excreted. So these four diseases are, there are so many diseases, these four are very important diseases for reversal of AG ratio. Sometimes MCQ question will be asked from this AG ratio. And finally, protein function, or some examiners will be asking you about albumin functions also, because this is very very important theory question. So you should know about the functions of albumin exclusively. The first one is, you all know very well, maintaining the oncotic pressure as well as blood pressure. Second one is, it only transports some compounds. Without albumin, they are not able to transport from in our body. That is bilirubin, calcium, free fatty acids, fat soluble vitamins like vitamin A. These are all transported by albumin complex only. Third is, it acts as a nutritional factor also. That is, albumin infusion is used for some bedridden patients, burns patients, shock patients, that is total parenteral nutrition. So they act as a nutritional factor. Last one is buffering. Fourth one is, you know the classification of buffer systems. First is bicarbonate, second is protein, third is phosphates. Buffer, protein, phosphates. This albumin is a protein which acts as a buffer, which is involved in maintenance of the acid base balance. So don't forget to mention about these four functions of albumin. Okay.